Hello, I'm Saskia Volkantonakis. I graduated from the University of Plymouth, UK's DBA program last year. This thesis research presentation is part of Global Health Week, hosted by the World Federation of Public Health Associations. Like many public health professionals, in accordance with today's theme, developing the right competencies within tomorrow's health workforce, you might be considering the importance of effective public health communication. For instance, do health authorities communicate effectively on how people can protect themselves from COVID-19 and other health threats? My research studied communication about prevention of HIV and sexually transmitted infections, STI, both major global health issues. Public health communication is a non-medical means of responding to epidemics and health risks, such as this early cholera example you see on the slide. Successful health communication clearly informs people how to protect themselves, slow the spread of disease, and access treatments and diagnostics. Addressing stigma and discrimination and reaching marginalized populations is a major challenge. Given the life-saving role of communication in culturally diverse contexts particularly, how can health authorities best communicate HIV and STI prevention messages? How to best motivate people to adopt protective behaviors? And how to communicate complex information? Identifying how to communicate effectively would not only help reduce the ongoing spread of HIV and STI worldwide, but could have prevented the misinformation and disinformation that sabotage some coronavirus measures. Becoming more effective communicators is a major non-medical means to ensure populations have the information they need to make healthier choices. How do authorities assess whether their campaigns effectively prevent infections? That may be difficult to measure due to complex interactions between audiences, media channels and media ecology, message content, and the targeting and communication strategies. Further complicating effectiveness measurement are changes in societal trends within highly mediatized societies and the cost and availability of screening and medical treatments. Many competing social science theories explain media effects on health behaviors. In order to gain insights on these issues, my research questions sought to understand firstly how the sample campaign was produced, secondly what the stakeholder interest and belief were, and thirdly how effective they believed the campaign to be. The analyses of media and interviews were then put into perspective using an additional multidisciplinary international review of literature and best practices to answer the final question. There is very little research examining how public health media campaigns are designed and what the stakeholder inputs are on planning. This lack of research into planning processes for media campaigns may be due to political sensitivity of the negotiations and consultations between communities, health officials, practitioners, NGOs, and media stakeholders. Therefore, their assumptions, beliefs, and perceptions remain often inaccessible to researchers. So in order to understand how complex media campaigns are planned, I select one campaign in one country for in-depth analysis. The case study selected in this research was the Swiss HIV and STI prevention campaign Love Life that launched in 2019. The campaign targets the general population represented by the grey dots on the map. Love Life is still active today, for unknown reasons, but possibly due to the disruption due to COVID-19. The Love Life 2019 campaign was intended for a national audience and was translated from Swiss German into French and Italian, as well as English. The language regions are visible on this map. Switzerland is an interesting case study because, although small, it is a highly diverse country, culturally and linguistically, with 4 official languages. It has a federal structure with 26 cantons or states, meaning public health policies and funding may be both national and highly local. For these reasons, Switzerland is representative of other countries with very different cultures and languages, and as such, offers fertile grounds for studying public health communication, attempting to bridge cultural and linguistic divides. In addition, lessons can be learned on health policies and public health communication from studying the federal structures, opportunities, and constraints that can inform public health programs in federal countries, like 4 out of 5 BRICS nations and 11 out of 20 G20 member countries. Switzerland has a relatively low incidence of HIV. However, like many countries, STI are on the rise, causing health problems and additionally adding to very high healthcare costs. The Love Life campaign was developed by major stakeholders, federal health authorities and leading NGOs, using an advertising agency in the Swiss-German region. It was launched in 2019 and is still the default campaign today for HIV and STI prevention. Love Life targets the general public, while other specialized campaigns, not studied in this research, target key populations, such as men having sex with men, MSM. The Love Life campaign is based on 5 main storytelling video clips with a duration of 6 to 10 seconds each, and their corresponding posters. They feature 3 female and 2 male protagonists, and the video series promotes male condom use. The films were analyzed in depth in the study using 7 distinct methods of media analysis. Their context within the digital ecosystem was analyzed as well, such as the online Safer Sex Check questionnaire, providing tailored recommendations to users. To complement the media analyses, semi-structured interviews were conducted with 12 expert interviewees from international organizations, Swiss medical practitioners, HIV and STI NGO managers, and international marketing communication experts. You can see the selection criteria on this slide. This study's design was based on grounded theory so as to explore and allow important themes to emerge organically and facilitate understanding about campaign planning processes. Also, grounded theory selective coding was key to theory development. To provide structure and precision within grounded theory, I used thematic analysis. Validity and reflexivity were ensured through triangulation, constant comparison, and memoing. After an initial literature review, utilizing mainly social sciences and marketing communication materials, it became clear during analyses that political science and cultural studies were also fields I needed to interrogate due to the politically charged and culturally dependent responses I received from stakeholders. Data were collected concurrently from stakeholder interviews and media analyses, including website parameters, although additional literature sampling and supplementary cultural and organizational analyses provided other needed data. This slide demonstrates how the diverse analyses, whether from the media analyses on the left or interviews on the right, as well as the literature, were processed using grounded theory and thematic analysis. The case study utilized innovative triangulation of media analyses methods using notably Goffman's theatrical frame and gender in advertising, and grammar, visual design, and social semiotics, among others listed on this slide. Such analyses made it possible to retroactively understand encoded values in the underlying mechanics of the media strategy in a pluridisciplinary and holistic way. Insights generated by thematic analysis and grounded theory methodology fed into the development of a substantive theory comprising 4 testable propositions to guide further research. It identifies relationships between culture, ideology, and values with strong implications for the principles and practice of public health media communication, particularly during the planning stages. Interview and media analyses brought into focus the interplay of contextual currents threatening Swiss HIV/STI campaign effectiveness on the population, environmental challenges that constrained effectiveness of public health communication in love life included the perceived gaps between federal and cantonal local policies and implementation. Ambient conservatism downplayed the role of female condoms and female agency generally. In addition, cultural individualism was identified as curbing the range of preventive solutions offered to the population. Lack of representativity and diversity of media campaign planning stakeholders, internationally identified as a key success factor, also constrained consideration of media narratives and content strategies that are more compatible with the population. The need for a supportive policy environment for public health communication campaigns was identified in this research as well. No matter how effective a campaign is in transmitting its messages, the population needs to have easy and affordable access to recommended condoms, tests, and pharmaceuticals. Based on the substantive theory, practical recommendations were formulated to address contextual issues. Firstly, a holistic content strategy for HIV and STI prevention targeting the general public. Secondly, HIV and STI federal policies, most notably easing access to diagnostics and treatments. Thirdly, inclusive and innovative processes for human-centered design and campaign planning. And fourthly, ethical considerations for public health utilization of digital media regarding technically enabled data protection, specifically as concerned personal data sharing, as in the case of the Safer Sex Check. I would love to continue this discussion, but here my presentation ends. Don't hesitate to get in touch with me. And many, many thanks to the WFPHA for making this presentation possible. I'd love to hear from you.